Goal 1, making Philadelphia one of the nation's safest cities. Responding and preventing fires, responding to emergency medical calls, community outreach, are all important contributors to this goal. Here to bring us up to date on key performance indicators and initiatives is Fire Commissioner Derek J.B. Sawyer and members of his executive team. On the administration side, we have Mayor Michael Nutter, his Chief of Staff, Deputy Mayor for Public Safety, Everett Gillison, Director of Public Safety, Michael Resnick, Director of Center of Excellence, Jackie Linton, members of the Fleet Department, as well as the Philly Stat team are also with us. So let's get started with some opening remarks from Mayor Nutter.
Well, thank you very much, and certainly Commissioner Sawyer and your entire team. As was indicated, public safety is number one in the city of Philadelphia, and public safety covers a number of different areas. But certainly with the long history and the recognition of the Philadelphia Fire Department as the first organized fire department in the United States of America, we have a tremendous tradition here, but also very, very high standards to uphold and maintain. I'm very proud of the work of the fire department, and while the fire department, again, is recognized locally and nationally, and our partners who are in Philly staff from time to time, the police department, we really have to have citizens understand the dynamic and the synergy between and among these two departments. At any point in time, police and fire can be on the same scene at the same time, providing public safety, doing their jobs both individually, but also with a level of coordination that helps ensure that our citizens are safe. And so with that, let's hear from Fire Commissioner and his team some of the great accomplishments of the Philadelphia Fire Department. We're very proud of you.
Thank you, Mayor. I'm honored to be able to present your number one goal, which is Philadelphia becomes one of the safest cities. So before I start, I'm going to have my executive team introduce themselves, start with Executive Chief Ray McCary.
Executive Chief of EMS, Ray McCary.
Executive Chief, Strategic Services, Yolanda Starr.
Deputy Fire Commissioner Jesse Wilson.
Deputy Chief Clifford Gilliam. Deputy Commissioner Jeremiah Laster for Emergency Medical Services.
Deputy Commissioner Diane Schweitzer, Administrative Services.
Battalion Chief Mark Erlacher, Special Investigations Officer.
All right, so we want to start off with talking about some of the major accomplishments under your administration. 24 fire fatalities in fiscal year 15, which is the lowest in recorded history. So we accomplished that not only during the fiscal year, but also during the calendar year. And this is a 27% decrease compared to 33 in fiscal year 08. And we contributed that success to our home visit program, where we have installed over 87,000 smoke alarms into more than 50,000 homes. And we've accomplished that through our various partnerships. We have a very robust partnership. Citizens for Fire Prevention Committee, which is our nonprofit, the Insurance Society of Philadelphia, just about all the universities, LaSalle, University of Pennsylvania, Drexel, and we can't forget St. Joe's University also. We just had our drama contest there. And then the American Red Cross, which we're in a partnership right now with a No More Fire Death campaign. And we've been out installing smoke alarms over the last 3 to 6 months, making sure that we can keep the city safe. And one of our most recent accomplishments is that we were just awarded a SAFER grant for $22.9 million, which will allow us to hire an additional 160 firefighters. What's not on here is we were just notified through the U.S. Fire Administration that we're going to be the only city, the only fire department, part of a pilot program where they're going to roll out the National Incident Fire Reporting System Data Exchange Warehouse. And what's the difference is, now with NIFRS reporting, you can only get your own data. With the Data Exchange Warehouse, you'll be able to look at everyone's data and do comparative analysis with other fire departments. So we're the only fire department that's been offered to be part of that pilot.
Congratulations.
I'm sure that comes as a result of a lot of the work that OIT and that you guys have actually done over the last few years. And I want to say congratulations specifically to your deputy commissioner and your other deputy commissioners that have had to really get in there, because I know how much that's been. And we have now, from what I understand from OIT, all the fire apparatus has been of the computers. Most of the fire computers now have been replaced. Is that right?
Yes.
And so we're now running, you guys are running at speed, and if we can ever get our issues with Comcast together, maybe we'll be able to get you all hooked up to the internet directly, and you'll be at even faster speeds. But I know that you've been reporting directly into your national stuff for the first time in the city's history, and that's been done. So I want to say congratulations, because that's not easy to do. And I know that a lot of the line officers and the line firefighters know that now the information is demanded, it gets in, it gets analyzed, and it gets right back out. And it's done literally overnight. If they just keep up, it'll be done overnight. And that's just great work. So congratulations. That's a hard thing.
Yeah, for the first time in department history, we got all of our infras data, fire and EMS on time. So we plan on continuing to do that. We have a process in place to ensure that that gets done. So we accomplish all this through our mission and vision statements. Since I've been the fire commissioner, I've taken the opportunity to revise the mission statement and to create a vision statement. And the mission of the fire department is to serve the public by providing comprehensive, all-hazard prevention, risk reduction, emergency response, and to ensure the health and safety of our members. I wanted to make sure I included the health and safety of our members because they are most likely to have something. And our vision is that we'll be recognized as the national leader in the fire and EMS industry for health and safety. So we accomplished our mission through the service of more than 2,400 uniformed and non-uniformed personnel in 2 divisions, 11 battalions, within 60 stations, utilizing 56 engines, 27 ladders, 50 medic units, 36 of which are advanced life support units, and 14 which are basic life support units. And we do this as being the 5th largest fire department in the country. If you look at our organizational chart, there are some changes since the last Philly stat. I'm operating with 4 deputy fire commissioners and 3 executive chiefs. The change is that we have implemented a deputy commissioner for emergency medical services and an executive chief for emergency medical services, and also an executive chief for strategic services, which is working on our new strategic plan. The benefit is that we have been able to hire 200 additional EMTs. So we hired a new job classification of EMTs. We hired 200, and they're now all working within the med units.
Everyone's in, they're all in the field.
All in the field.
How's it going? How's the transition?
Transition has been great. I think initially there was some apprehension, but after doing some follow-up, we actually even had a forum with the paramedics and the EMTs. They all say that they love the job and they're getting along well.
Operational Commissioner, can you just explain a little for the public what that means? 200 more EMTs, firefighters now go back to being firefighters. We're able to put more medic units in the field. We're able to reduce costs. I mean, just a little bit about what that program does for the citizens.
So it does a couple of things. One, it allows us to stop using firefighters in the medic units, which reduces our overtime. And it addresses the Berkshire report when they talked about how firefighters didn't really want to work in medic units. So now we have EMTs dedicated to that position, and it reduces our cost for overtime. It's going to allow us to add additional medic units to the system. So right now we're operating with 50 medic units. Over 3 years, we plan on adding 5 additional medic units. So in 3 years, we'll have 65 medic units.
Oh, you're gonna add 5 a year for the next 3 years?
That's
Wow.
the plan. And then it pushes up to
Yeah.
65.
Right.
Will help-
Which should
will help
reduce your
us-
runtime.
Exactly.
Right, and provide better services.
And provide better service. So we accomplish what we do through 4 performance measures, which are EMS response times, fire response times, fire fatalities, and civilian-related injuries. So the target for EMS response times is 9 minutes, 90% of the time. And as you can see, we have not met that target as of yet. There's been and one of the reasons is there's been an 11% decrease over the last 8 years in EMS responses. So look at the fiscal year 08, 215,000 runs, to fiscal year 15, 243,000 runs. So with this new system in place where we have a deputy commissioner of EMS and an executive chief, and with the hiring of the 200 EMTs, we expect those runs to go down and the times to increase and get better.
How are we doing on our, what I would call the spread between real calls responded to and those that are, once we go out and we see that it's really just an abuse of our system. You understand what I'm saying?
You have a priority call system.
Priority call system
What
is
is
now
that?
in place. How is that really helping us differentiate between somebody that just needs to come out and get, I think that you once told me at one of these Philly stats, I need the channel on my TV needs to be, I dropped the remote. Can y'all help me with that? Give me a little breakdown on that issue, because we really do have to clamp down now that we have a priority system in. How are we using it to make sure that we're telling the public 911 for emergency only?
So we're utilizing a twofold approach, and we do have priority dispatch now, and I'll let Deputy Commissioner Lassiter speak on that. But also, we've implemented a community risk reduction for EMS, and what they're doing in the CRR unit is addressing the super users. So we can address the super users initially and get those calls down. That's going to automatically help us with the whole system.
Okay.
So we're in the process of conducting the pilot program with Friends Hospital, which is one of our super users. We were responding there like 10 times a day, and we have a pilot so that when they call us, we'll still respond, but if it's not an emergency, they'll have to get another means of transportation. So that's just started, and we're working to see how that works out before we implement it throughout the city.
And the medical priority dispatch system actually works well. Right now, it's focused on low acuity calls where things that are not an emergency or life-threatening emergency will actually send on a code response. That means no lights and sirens, which actually helps us to reduce liability, accidents, etc. We're still working very hard to try to get an alternative transportation system in place for those people who really don't need 911 in the first place. They simply need a ride or a medical home to get to. So along with the community risk reduction program from EMS, we're going to be working with some insurance partners and some hospitals. We just recently also got access to the public health database, so we can do assessments of communities. And we're going to have identified at least 2 communities that we're going to do some PR in, so we can focus on getting rid of those low acuity calls. So we don't even have to send a medic unit before they even get in the system. So that's what we're really trying to go to.
When you say an alternative transportation, you mean along the lines of you don't really need us to send an EMS unit. What you really just need is a ride someplace.
Right.
So if we had something in line of a voucher system that could actually pay for that ride, we would not be able to have to send medic and an EMT plus a box in order to help get you where you need to go.
That is correct, and it's much more cost efficient.
All right.
And then long term, we're talking about community paramedics. So this is just the initial phase of trying to reduce the number of calls, but there's a lot of moving pieces.
Good.
Let me ask this question. Tell me about the analysis of FY08, 215,000, FY15, 243,000. It's about 28,000 more runs. What's the analysis on those runs? Why such a significant increase? And are there particular areas, particular types of calls that dominate in that 28,000 increase? And it's been steadily going up.
So the EMS runs have been going up across the country, and the initial analysis is that we have an aging population, especially in the city of Louisville. So we have an older population. Not everyone has health care, so they don't go to the doctor on a regular basis. So they wait till they're really, really sick to dial EMS for us to come get them. So that's the initial analysis. As far as the types of calls, you should be able to speak.
Right. I mean, a lot of people have chronic medical emergencies, and they rely exclusively on 911 to respond. Part of the emergency medical services community risk reduction program is going to be working with those hospitals and those physicians, so we can identify those people, as the Commissioner mentioned about the community paramedicine program, so we can identify them and treat them before they even have to leave their home. What's going to help is the Affordable Care Act, which is putting in a lot of pieces that we can utilize in the future so that we can get paid for actually going to those homes and identifying those people with low acuity calls or chronic medical problems so that they don't have to be transported to a hospital in the first place. And again, it was about insurance, but we're looking forward to full implementation of the Affordable Care Act so people will have more access to insurance
now they're able to go and seek medical care without having to utilize 911 as their primary choice.
All right, second performance measure, fire response times. And based on the standard, is that the fire department responds within 5 minutes and 20 seconds. And we've consistently met that standard. As you can see, fire calls are from 48,000 in '08 to 49,000 in 2015. So the number of fires has actually gone down over the years, which I attribute to our community risk reduction efforts, public education efforts. And it's based off of NFPA 1710.
So you had a pretty steady incremental decrease from '08 to '13, and seemingly a significant, somewhat of a significant jump from '13 to '14 and '14 to '15. What's happened in the last couple of years?
So we attribute that to the way we record fire responses. So we talked about the INFRS system earlier. When we fully switch over to INFRS, they record fire responses differently. So what we were recording, considered as a fire response prior to the INFRS, before implementation of it, they add more categories. So that's the reason for the increase.
When you say more
It's a
categories,
definition.
what do you mean?
So
Autonomy, thing as opposed to the ones.
NFIRS counts more things as fires
Right.
than did we previously. We counted
Ah.
only structural fires. NFIRS requires us to count pot of meat,
yeah,
and alarm systems and other things.
So if you got the meat on fire,
Yeah,
that's a
so
fire
it's a fire,
incident.
right.
It's a fire
Therefore,
incident now.
before, we didn't count it.
Right, because what
Now
we
we
do
do.
before, we just go in and take the
Go in,
pot off the stove.
take the pot off the stove and it's done.
And now they count.
Now it's a fire.
Yeah, NFIRS thinks if there's smoke throughout your property, and
Yeah.
it can be toxic smoke,
Right.
which you count it as a
Well,
fire
let me ask this
incident.
question.
Especially if you burn that
Especially
stuff.
for burning. Yeah, well, burning an aluminum pan, it's bad.
If we were just looking at structural fires, I understand the system as you have to report it, but, and if you don't have that material right now, I would be interested to see what's happened over the last 8, 9, 10 years from a pure structural fire standpoint.
The way we used to count.
Yes.
I'll take
So,
that.
2013, 6.5% reduction, 2014, 6.3 reduction, and 2015, 5.9% reduction. So we had 2,946 structural fires in 2013, 3,000 went up in 2014 to 3,057, but it then went back down in 2015 to 2,940 structural fires. And we classify structural fires as being in service for 30 minutes or longer.
So what are all, I mean, if there are only 2,000 to 3,000 structural fires, I mean, you've got 49,000, let's, before this new system, let's go back to 13, 45,000 incidents.
Right.
What are all the rest?
There are fire responses, so there could be alarm systems, it could be personal fuel spill on the highway, there's still fire responses. So we're in an all hazards response organization. So we go to fires, alarm systems, hazmat incidents, car fires,
Motor vehicle accidents.
Okay.
rubbish fires.
I understand. So, why don't we do this? By category and by year, if you could put together a comparative analysis of these different categories, and, you know, for FY13, it should add up to, you know,
Gotcha.
45,000, for 15, whatever that, 14, 15, whatever those numbers are. I'd just like to be able to see where the activity is along the spectrum of what anybody calls a fire response, to, you know, really see what our folks are doing. I mean, I know they're out there, and we have all these incidents, but, I mean, clearly, there's more going on than buildings on fire,
That's true.
right, which is traditionally what people think most firefighters are doing. There's a whole bunch of other activity that takes place, and again, we have to educate the public about what all that other activity is. Because, I mean, if you're at 3,000 in a rise year, 2,000 to 3,000 out of, I mean, that's you know, it's like 5% of the work, of the incidents, is fighting fires, at least in a structural environment. So, I mean, clearly our officers are doing many, many other things, which also help to contribute to, you know, pretty significant reduction when you get to your next page. We can use that as a lead-in. I mean, dramatic reduction in civilian fire deaths, FY11, pretty much for the next 4 years in a row. And, I mean, we haven't really talked about it much, you know, knock on wood, but, I mean, given where we are right now, I mean, hopefully, if things just stay where they are, I mean, this would be the most incredible all-time low ever in terms of civilian fire deaths. One is too many, just like shootings and homicides on the police side. But, you know, I mean, unfortunately, some things happen, and I know the analysis, I mean, we've got our two, you know, kind of ends of the age spectrum to some extent, still being our most vulnerable populations. You know, it's older people and really young kids. And, I mean, we really have to, you know, that's about information, it's about education, it's about not going back in, it's about knowing where everybody is, it's about having a plan before we show up at your door. You know, when you smell smoke and everybody's running around, I mean, you got to gather folks up and, you know, take the quickest, safest route out. But, I mean, in many instances, I mean, I know our goal is 0, and that should be our goal, and that's our daily struggle every day. But, I mean, we really have to double our efforts with regard to these populations that we continually see as the most vulnerable, and really try to drive home, you know, kind of a kid message and an older adult message. I mean, it's a message for everybody in this. But these are, in many instances, they are preventable. I don't know what the current stats are, but I seem to recall that about 75% on average of our fire deaths are in homes that either did not have a working smoke detector or didn't have one that wasn't working, or didn't have one at all. 75%. So again, we know, because there are a lot more fires than that, and the people who do have smoke detectors almost always, you know, get out and survive. This is something that we can really drive this particular issue. It's about your work, the officers being out there giving out free smoke detectors. So, you know, we should not let money get in the way of a person's or family's public safety. We're putting the smoke detectors in. We're doing the 10-year, hopefully, lithiums, or 7-year, or whatever it is that you get. Check them once a year. Pick, you know, New Year's Day, anniversary, birthday, whatever you want to pick. And we can do something about this. And it's tragic, some of the things that have happened here in our city. And in a very different way than the crime on the streets. This is about you in your home, right? And there are certain steps that the citizens can take, and then we're going to do everything we can to make sure that folks are safe. But we have to really try to emphasize, and I can certainly do my part in talking about these issues with our seniors. So really double down on our partnership with Mayor's Commission on Aging, and then, and these are not even school-age children, but certainly re-emphasizing with our daycare centers and all those folks. I mean, it should really just be a part of what kids learn about in terms of fire and fire safety and having those home safety plans. You know, so I feel I'm very passionate about this particular issue.
Me too, trust me.
I know you are. I know it hurts the officers when they lose them.
So civilian injuries is another performance measure. And over the last 4 years, 2 out of the 4 years, we've accomplished our goal, which is 165 civilian injuries. So the top 3 causes for civilian injuries: open flame, electrical wiring, and smoking. So what we've done is we've tailored most of our fire and life safety education to those messages. And every chance we get, we send out email blasts to fire safety representatives. We send out information to radio stations and have campaigns to address these issues.
Now, unless something has changed, are we still at 10 civilian fire deaths this year?
10 this year as opposed to 22 last year.
Right, at this time last year.
Same time last year.
And where are we, if you know, on civilian fire-related injuries year to date?
Here we go. So injuries, we are 2015, 89 Last year, this time, we had 115, so we're 26 ahead. So we're doing a better job of injuries also.
Give me those numbers.
89 civilian injuries. Last year, at this same time, we had 115 civilian injuries.
Okay.
So the more we reduce the injuries, the more we reduce the fatalities, and at
Right.
some point, you should get to nobody dying and maybe very few people being injured.
Right. Let's talk about the members in the injured category. How are we doing in protecting our own homes?
You have the injury.
I don't have the injury data. Injuries are up, unfortunately. So are accidents.
Do we know why?
A couple of reasons. One of the reasons for accidents are all the new employees we just hired. That's one reason. The reason for injuries I haven't nailed down yet. I just met for 2.5 hours with the safety officer this morning to try to nail down what the real cause of these injuries are and why we see an uptick in them. We're not doing egregiously bad over last year, but I don't have the data with you. I'll be sure to
Let me
make sure
get
we
that,
get it.
please.
Is the nature of injury burns or, muscle strain,
No,
sprain?
they are below the waist injuries, slips and trips, falls, ankle twists, and things like that.
Give us and again, I'd like to see something over the last 5 years or so.
Absolutely.
With the members and turn it down and types of injuries. And then we really need to see a game plan on how we can better protect the members out there doing the job.
So if you want, we have a copy of the breakdown of all the different types of fires over the last few years. And that'll help you see the different types of fire responses that we broke down by category. All right, so how do we achieve our success? I talked about our homes visit program.
Is the meat on it?
I'm quite sure it's already
Private
seen.
meat?
Yeah, it'll be on like a 505 or something.
Anyway, keep going.
Yeah, so we increased the number of fatalities and injuries by our public education campaigns and conducting home visits. For example, between 2013 and 2015, we had 66 fire fatalities. In 2000 alone, we had 51. So that shows that our home visits are working and the education campaigns are working. So we've embarked on a new campaign with the American Red Cross, No More Fire Deaths. And what they did for us is conduct an analysis through a company called Boston Consulting. And they pointed out three main reasons for people dying in fires, which is the cause of ignition, time of day, and
The
area
what?
origin.
What was the first?
Cause of ignition.
Okay.
So three contributing factors to
Cause of
people dying.
ignition.
Time of day,
Time of day.
area of fire.
Okay.
And they helped us identify risk groups, and Battalion 7 was one of those areas where we had a large number of people dying in fires, so that's where we started our pilot with the American Red Cross.
What's the, I guess kind of the number one or leading time of day?
Between midnight and 7 is the time period when most people
I
die.
thought it was a night, more of a nighttime.
More nighttime.
Experience. And cause ignition?
Open flame. So that could be candles, unattended cooking, smoking,
Yeah,
open
location of the house.
bedroom. Another interesting fact that we found out is that most people that die in fires, they die within less than 1 mile of the fire station. Less than 1 mile of the fire station. So that tells us we have to make sure our members are not going too far, but it's right in their 1 mile radius to address all those homes. If we can address all the homes within a 1 mile radius of a fire station, that gives us a quick win to reduce the number of people dying quickly.
Data analysis.
The analysis. 1 mile. Who would think 1 mile?
Right, yeah. Yeah. Okay.
But since June 1st, when we started the pilot, we visited 721 homes and installed more than 1,600 smoke alarms. So we're making good progress with that.
Commissioner, you're partnering with 311 also.
Yes.
For those who want or need additional.
So, yeah, part of our pilot program, we're asking everyone to call 311, and we develop an application through Esri GIS that shows up on the MDTs in the vehicles where those requests are coming from. So that if a person is out on the medical run, and they're in the same area, they see, wait a minute, right down the street, Mrs. Jones with the smoke alarm, they can go take care of it then. And what we're doing with the pilots is we're leafleting the neighborhoods before we come out, so that they know we're coming, and we have a better chance of people being on. So even though we had some successes, we still have some key challenges. Those challenges are wellness and fitness, technology, and ongoing infrastructure and equipment needs. In reference to wellness and fitness, we're working with risk management to develop an RFP to hire a vendor to start doing the physicals. Once that RFP is approved, and we have a vendor, that wellness and fitness process will start to kick off.
How far away are we in getting that accomplished?
I talked to Barry just about a week ago. He tells me that it's well on the way. Maybe by the end of the month, we'll see something that looks like a draft for an RFP.
So do you think that it's reasonable to have the RFP on the street for during September with a returnable time sometime in November?
I don't want to speak for risk management. I'm not sure about that, but I'll certainly communicate with them as frequently as I need to see if we can get that done.
Let's get it done as quickly as possible.
Technology, even though we've had some advances in technology with getting new computers in the stations and things, the next phase is mobile integration, as you talked about, Chief of Staff. Mobile integration so that we can do inspections in the field, so that we can track our VBIs and things like that. So that's the next phase for us with the technology piece. We already started developing applications for smoke alarm installations, but we need the mobile interface so that it can be real time. We want to be able to put the alarms in, enter it on our mobile devices, and we go right back to the database and update the database.
The question I have, and I know that since the mayor had placed L&I in the public safety environment now, and we have been working, there's a great integration now between the fire department and L&I. Not that it wasn't there before, but as a result of a lot of the changes that have been made, we've now enhanced. And I know that we're at a critical time. We're about to, we have people in the academy now. There's going to be another class that'll be coming out. We do need to dedicate probably 3 lieutenants to that task force, so that we can get that and maintain that as we go forward, so that we can make sure that we're building in that to the culture. As you guys know, I dare say that over the last almost 8 years, almost half the fire department has been hired. I mean, that's when you're talking about there's a lot of newbies on the block. About out of 20, we've had at least close to 1,000 new members in the last 8 years. That is going to continue with the aging and the replacement, so we have to get this new culture to understand that integration is how we're going to really make the step into the 21st century. So I know it might be a little counterintuitive to take a little pain now, but if we could identify some people who are early in their careers, they just made lieutenant, but they really understand the integration between L&I and the fire department, and to take that on as their career as they begin to continue to move through the department. But that's an area, I really think that we should emphasize that, and we should reward them for making that step. So I know that I'm going to have a meeting, and I'll call you over with the Commissioner Williams and you, Commissioner, we can sit down, but I know the mayor would like us to really get that nailed down as we are going into this transitional time, to make sure that that's staffed properly, maintained, and if L&I is already going to get new equipment, that's a way that the department can kind of get new equipment on the back end as we then build it going forward. And then, Diane, you can actually then make sure that it gets part and parcel of what we're doing on our reporting. But if we don't do it now, we'll miss this moment, and we can't miss this moment at this point.
Well, we've already identified members that have the training, and matter of fact, they participated in the pilot with L&I to go out and do inspections. And Executive Chief Stallings have already put together a plan for us to train the rest of the lieutenants in the department. So we are moving forward. We just have to fit the training in with all the training that's going on with the new cadets and all, but we are definitely moving forward. We have it in the budget to hire the new lieutenants for those positions.
Okay. Just want to make sure that, because I know that the next, I believe that the pilot was in battalion, which one?
8.
Battalion 8.
Yeah.
I think that they're gonna expand, the next group is gonna go into Battalion 5?
Council District
Oh, okay,
five.
okay, so whatever Council District 5
Right.
relates to the battalion, but that's where they wanna go, and that's, as we all know, that's a huge number of abandoned
Battalion 10.
industrial places, and I don't, we never wanna have another one of our members go through that. So it's no longer pilot, this next move
It's implementation.
is implementation of the program, and they're gonna be working a lot, because there's a whole lot of abandoned industrial sites that have to be investigated, cleaned, whatever, photographed, and then get all that information into your MDT so you'll be protected. But we have to do that. We owe it to the members we've lost to do that.
So, last challenge is ongoing infrastructure and equipment needs. If we look at the average age of our buildings, 57 years of age, and with the newest being 3 years, which is engine 38, and the age of our fleet also.
Well,
So when you look at the next slide, and you talk about the average age of the apparatus, according to the NFPA 1901, which says that we should replace our apparatus every 15 years and the reserve apparatus after 25 years, we're not doing too bad for as frontline apparatus, but we can do better with our reserve apparatus. The average age of our engines are 8.9 years of age, 11.9 for ladders. Medic units are very good, 2.8 years, and our command vehicles, 5.7. Over the past 3 years, we've purchased 21 new engines, so it's not like we haven't been purchasing apparatus. The situation is when you purchase apparatus such as engines, ladders, and special apparatus, you can't go and just say, I want a new engine today and get it tomorrow. So if I want a brand new car, I go to the dealer. If I have the money, I get it today. When you order a $500,000 piece of equipment, have to expect that it takes about a year for them to actually build that apparatus into deliver. But like I said, over the past 3 years, 21 new engines, 2 new ladders, 20 of the 25 medic units that we've ordered has been delivered, and we've received 5 of the 8 new command vehicles. So we've been constantly moving on. In spite of the economic downturn, we still have been purchasing equipment, and we have a 5-year plan to do even better. So that 5-year plan says, over the next 5 years, we're gonna buy 4 new engines per year, 4 new ladders per year, and 10 medic units per year. So after 10 years, we have 50 brand new medic units. So we have a plan in place to address the aging fleet. As you can see,
You said after 5 years.
after 5 years, we'll have 50
Right.
new medic units, which means our reserve units will be newer also.
Right.
When you look at the cost of $500,000 for engine, $1 million for ladders, $250,000 for medic units, like I said, these are small ticket items, so it takes time for us to build up our fleet. So what's on the horizon?
On that, just one last thing on that, Commissioner, what I'd like you to do is, with those purchases in mind, show us, I guess, in 5 years, what this chart would look like,
Gotcha.
based on these already anticipated purchases.
Great.
And where average age would be at that point, our average age as compared to national standards.
Gotcha. All right, we think about what's on the horizon. We are just about finished our strategic plan. We laid in front of you a copy of our strategic map, which our strategic plan is based off of. We also are just about finished putting together our community risk reduction plan, which details our integrated risk management approach. And we have partnerships with LNI, which you spoke about earlier, so that we can enhance citywide inspections capabilities. I talked about the pilot with the U.S. Fire Administration, which is a new initiative, and I also gave you a copy of the result of the Work Ready program with our Explorers. Our Explorers participated in the Work Ready program. They put together a powerful presentation, which I would like them to present to you at some time,
Okay.
that talks about how to save, or how to track saves. So instead of saying we lost property and we lost lives, their program gives us a way to track success stories. We saved 10% of the building, which if it's $100,000 house, and we save, let's say 25%, that's 75,000 saved. And what that does is, it allows us to report to the insurance industry that we're saving them property, and maybe we can get them to partner with us, because we're saving them money. But they did an excellent job doing their work study
Okay.
program and powerful presentation.
Great. Just, you'll work with the chief, and I'd love to hear from these young people about what they're doing, and encourage them to.
Yeah, they did it all on their own. They did the research, the data analysis, they tracked other cities. It's powerful.
Good, good. Okay.
So if you want to find out more information about the fire department, we have our Freedom from Fire website, our Philadelphia.gov website, and we're on Twitter and Facebook.
The other piece that I would just add, but just that you talked about the Explorers, we're always, and I know that one thing we're constantly doing, and HR usually helps us a lot, is to get, and I want to thank HR for them getting people through the system. I mean, they really have, when we needed to get firefighters to go through the system, they've been helping, they've been moving. Sometimes it fits in, and we could get a class and whatever, but they put them through. The mayor has always been very, very close to our Power Corps PHL folks, that we are trying to get and expanding their opportunity to work with your agency would really be powerful. I know they're working streets. I know they're working in water. I know they're working in other areas, parks and recreation. Having you guys be part of that and using Explorers is still, you know, what they are, is giving them another shot at being a really contributor to our community. So let's, you know, take a look at, when you're looking for people to kind of help you do some stuff, Power Corps is out there. You know, draft some of them, and talk to Katie Wolfgang.
Well, two things. It's Power Corps PHL. It's also Philly Future Track. So we have the streets department, and well, that was the day you guys were here. And you know, part of what those young people are doing is they're cleaning alleys and cleaning lots, where at times, midnight to 7 a.m., the members are going in to fight fires. Hopefully, it's a cleaned and cleared alley, as opposed to kind of overtaken by vegetation and the like. So, I mean, they're doing some things that are already helpful to the members that they may or may not even know. But these are enthusiastic young people who recognize that they're getting a second chance, some maybe even a first chance to do something. Some have already been hired by those departments. I mean, they take the test like everybody else, and they pass the test, they get some extra points for having been in at least the Power Corps PHL program. But we should look at them again for recruitment opportunities, and they're young, they're hungry, they're aggressive, they want to do some things, and they're very proud to be a part of city government. So let's give them an opportunity in the fire department as well.
We will do that. And to answer your question about the 5-year projection, so pumpers are 8.9 years of age. In 5 years, they'll be 3.9 years of age. Ladders, 11.5 years. In 5 years, 3.3 years. Medic units are 3.9. In 5 years, 2.2. And command vehicles are 6.4. And they'll be down to 3.6 in 5 years. So with that 5-year plan, you'll see a dramatic reduction. And this is a powerful that just for your information.
Thank you.
The last thing is the fire
You
department.
guys work pretty quick. I mean, I just asked for that. I didn't even see you get up. The machine. You guys blow something down there. This is great.
Safer grants over the time of, from 2008 till now, we've won, is this our second one?
It's the second one.
It's the second one. The first one was for how much? Does anyone recall?
16 million.
So 16 million the first time around,
Right.
22 million this time. 2 safer grants within an 8-year
It's
period.
extraordinary.
It's extraordinary work.
Great work.
Really
And
work.
another thing, we're in the process of waiting to hear back about a 1.2 million grant for fire prevention. And I'm working with Ed Fisher to work on another grant for apparatus, help us with apparatus issue.
Great,
So we're working with grants also.
great work.
Keep it up. All right.
Sir?
Very proud of you.
Thank you.
Thank you.
Great. Well, we continue to see improvements in service and performance from our fire department. For more information on this department and others, please visit the Philly Stat website at philly.gov/performance. Thanks again for tuning in, and we'll see you next time. Thank you, Commissioner.
Thank you.
Appreciate it.